And then at 8 months old, I had a 10.5 hour long operation where my eye sockets were completely removed. My skull was completely reconstructed. I now have a scar from behind each ear all the way around, where they had to separate my skull and put it back together to allow my brain to continue to grow.
Welcome back to Brain, y'all. Today, I'm sitting down with Sophia. She is a student at Texas Christian University. Sophia, welcome to the show.
Hello, thank you for having me.
How are you doing?
I'm doing great. How are you?
Good, good, thank you. So
Good.
our viewers need a little bit of a background of who you are. So you're a student at TCU. Give us what are you studying? What do you want to be when you grow up?
Yeah, I'm currently a junior at TCU. I'm studying biology with a minor in psychology, with hopes to hopefully go to medical school after college, which I'm really excited about. It's been my dream since I was really little, and so almost there. I'm almost there.
Almost there, yeah, but
Almost.
once you graduate, you got 4 more years of medical school.
Yep, and then at least 3 years of residency, but
Oh my
we're
gosh.
almost there.
Yeah, you got it. Just 1 year at a time.
Yes.
All right. So you have a very unique story. A lot of
Yes.
people that I've met in all the rehabs I've been to, their brain injuries, they've had a stroke, they've had an aneurysm, they've had a traumatic brain injury. But I've never met somebody like you that your story to me was uh, just jaw-dropping. Me and
Me
Sophia,
too.
yeah, me and Sophia met at TCU. I had given a presentation about brain injuries and my accident and life now, which I love to do. And you had the courage to come up to me and share your story.
Yeah.
So I want our viewers to hear your story from your point of view. So you take the reins. You tell us
Yeah.
everything.
So, a little bit of background context that I feel like is important. I was born with craniosynostosis, which occurs when the sutures or kind of separations in your skull fuse in utero prior to being born, and that restricts brain growth. And I was born, and that my parents didn't know that that had happened to me. It was not something that was diagnosed in utero. And then my mom kind of noticed that I wasn't really using my eyes. I wasn't tracking with gaze. I was really only turning my neck. And she was like, something's wrong. Mother's intuition. She really noticed something was wrong. And so they went to many different specialists. And at 3 months, I was misdiagnosed with a brain tumor, an inoperable brain tumor at that. And they told my parents, take her home, love on her. We don't know what's going to happen, but this is what's going on. So my parents took me home and they didn't really know what to do. I'm my parents' first child. And so they were kind of trusting the guidance of these doctors, as most new parents would do. You trust the authorities. And they took me home, but my mom kept saying, I don't think this is what it is. I don't think this is what it is. Something's still not right. And so they took me to another specialist, and I was in California at the time. They took me to a specialist in San Diego, and he walked in. He saw my skull, he felt my skull, and said, "This is not what's going on. She's craniosynostosis. You need to take her to LA Memorial, which is a large hospital in LA, um, and you need to have her checked out because she needs surgery." Because with craniosynostosis, if you diagnose it before the age of, I believe, 6 months, kids wear those funny helmets that you see. They're so freaking cute. But because I was at this point, maybe 6.5, 7 months, my skull had completely fused. My brain growth was being extremely restricted. And the only option was surgery. So my parents drove me all the way up to LA from San Diego that same day to have me evaluated to then have surgery. And then at 8 months old, I had a 10.5 hour long operation where my eye sockets were completely removed. My skull was completely reconstructed. I now have a scar from behind each ear all the way around, where they had to separate my skull and put it back together to allow my brain to continue to grow. And so that went off without a hitch. As far as we were aware, no complications. My parents took me home, loved me. I grew up. And then at about 12 years old, 10, 11, 12 years old, I started experiencing the worst migraines known to man.
Mm,
I was having really large impulse control issues, in school with, talking to others, talking to my parents, talking to my teachers. And then the scariest thing was I started experiencing what we thought to believe were absent seizures. So not grand mal seizures where you fall on the ground and your arms are jerking, but seizures where you just kind of gaze off and no one
mhm.
could get my attention in class, no one could get my attention at home. So that was really scary for my parents because they had already went through absolute hell with me as an infant. And then at 12, 13 years old again, they're going through all of this, and saying, what the heck is wrong? This isn't normal. And my migraines were impacting my daily life. What we thought were absence seizures were impacting my daily life. And so we go to Dallas. I moved to Texas at this point to see a specialist. I had my first brain imaging at 12 years old. I had never had an MRI or a CAT scan previously in my life because with craniosynostosis, it's strictly brain related.
Mm,
And they didn't believe my brain growth had been restricted that much to where it was super severe. And so we had my brain imaging, and I remember this day so vividly. My dad remembered this day so vividly. So does my mom. My neurologist kind of pulls my MRI to the side and asks my parents, did she have a stroke as a kid? Did she lose
mm.
oxygen as a kid? Trying to get context. And my parents were like, no, not that we know of. And she said, well, she has scar tissue and loss of brain mass in her front right lobe that's consistent with loss of blood flow or loss of oxygen, with stroke patients or with, patients that experience like massive traumas. And my parents were like, what the heck? What?
Jeez.
And so that was kind of the day we found out that I had a entire chunk of my brain kind of died off and missing, and we have no clue what happened.
Sophia, first off, you are a freaking warrior
Thank you.
for everything you've gone through. Your parents are the the poster child for parents. I mean, their selflessness, their the mother's intuition,
Oh,
them
yes.
them digging to find answers for you. Now, you just threw a lot at us, and
Yes, it's a long story.
but you told it so elegantly. I have very bad short-term memory, and I have a horrible migraine right now, so my memory is even worse. But I was just taking notes
Mhm.
frantically because I want to rewind because there's a lot of questions that I have that I'm sure our viewers are going to have.
Yeah.
But we're going to break it down piece by piece.
Okay.
So we talked about that initial diagnosis before you were 6 months old, right?
Yes.
And it seemed that the doctors misdiagnosed you.
Oh, yes, they did.
And then your parents amazingly took you for another second opinion, correct?
Yes. Yes.
That doctor's like, goodness gracious, she needs surgery right now, right?
Yes.
So initially, your parents are told, love on her, she might die soon.
Essentially, they didn't know what was going to happen. I have no clue what kind of tumor they thought I had. They thought it was kind of behind my eyes, and it was an operable. And it's my mom doesn't like talking about this point in my life just because it was a really traumatic point for her.
Oh, yeah.
There were a lot of things that happened, and for it to be her first child, that's a lot of stuff to go through.
Oh, my gosh.
Um, and so I think they were maybe trying to go to another specialist to see what kind of tumor, or, am I going to die or am I just going to be visually impaired? Am I going
Mhm.
to have motor issues? Um, but they were just told, go home, there's nothing we can do,
Yeah. And
which
how
is awful.
terrible for, doctors not to dig for more answers for
Hmm.
your parents, kind of leaving it up to, their decision like, hey, good luck.
Yeah.
But how amazing before this misdiagnosis where your mom captured, hey, her eyes aren't tracking. She's just moving her head, right? This was what sent
Yes.
you to the doctors in the first place.
Hmm.
One of the first signs. And then give us the time frame between those doctors giving horrible advice to when you went to another doctor and they're like, let's do surgery right now? What was that time
If
frame?
Yes, if I'm not mistaken, I was around 4 months old when I went to the first doctor and they said brain tumor. And then they tried an eye patch. I was a pirate for about a month just to see. It was kind of like a last straw.
Hmm.
Maybe she just has a lazy eye, which I did have a lazy eye, but it was a result of my brain being squished.
Yeah.
And so that was around 4 to 5 months old. And then 2 months pass, and I'm now 6.5, 7 months, where they go to San Diego for this other specialist, and they walk in the room and all he does is feel my head. He doesn't talk to my parents. He doesn't say anything. He feels my head and walks out, comes back in and says, "You guys need to go to LA. She needs surgery."
Like
And then
right
I had
now.
surgery like essentially in the next couple of weeks. That was about 7 months old, and then at 8 months is when I had my surgery on May 5th of
Wow.
2006.
Wow. Okay. A date your whole family is going to probably remember forever.
Oh, we lived that day is one of the most memorable days. My dad can barely remember my birthday just because he's a dad, but that day is a day he never forgets. He texts me every year.
Amazing. I mean, a celebration of life for you. That
Oh,
changed
yes.
the way I mean, if that doctor hadn't come into your life, if your parents hadn't fought for that second opinion, you wouldn't be in
Hmm.
college right now. Who
I
knows
100%, just
where you'd be?
because I do a lot of research on this condition, a lot of my psychology assignments in college now, this is a topic I choose to research, and without surgery, and without the helmet intervention, the one thing that happens is brain growth is just completely restricted.
Uh,
And so I probably would have deficits that just compile, because nothing was ever done.
and this was caused in utero, correct?
Yes. So when babies' skulls are forming in utero, normally there's soft spots
Hmm.
on a baby's skull to allow for brain growth. And my soft spots decided to form together and harden and close.
Did doctors, obviously this wasn't diagnosed until 6 months, right?
Mhm.
Like
Yes.
for 4 months or like it's a tumor, 6 months, well, you had the surgery.
Around 8 months, yes.
Okay. So did they give you, did the doctors ever give an answer as to why this happened in utero? Is this genetics? Is
So
it?
yeah, it typically there's two types of craniosynostosis. You have syndromic and non-syndromic. This is just what I've learned kind of being interested in this condition. And if I'm not mistaken, what I had was syndromic, and it typically is genetic. Now, upon my research, I have found that it's genetic depending on the dad.
Hmm,
I tried to make that joke, and my dad wasn't very happy with it.
doesn't land.
Doesn't land at all. And so it is genetic, but then sometimes it's just a fluke, it's
Interesting.
something that just happens. And the great thing is with modern medicine, there are those early interventions. I see kids with helmets all the time now, which I love it because I know what they have, and I know a doctor caught it early enough
Yeah.
to allow them to have a helmet. And so for me, it just wasn't the case. And that's just what's so interesting about it is it really is one of those conditions that, it is genetic, but then sometimes there are like external factors, like maybe there was stress in the utero that, caused the skull to kind of harden. But there's like a million different things that could happen to lead to this condition.
And the body is fascinating.
Insane. I mean, crazy.
Jeez. Okay. Now I've jumped around a little bit. We had how it happens, diagnosis
Yes.
in utero, which you are an expert. Incredible. And you broke it down so easily for our listeners to digest. Now we talked
Thank
about
you.
the early months.
Mhm.
Let's talk about you going to LA. Obviously, you don't remember, but this is probably your parents' perspective, right? The
Yes.
surgery, the intense surgery. Give us those details again. They removed your eye sockets.
Yes. So I actually I've looked up the surgery online. It's gruesome. I mean, it's ugly. But with my specific craniosynostosis, because there are different kinds, because you have a couple different sutures on your head. So you have one that goes down the middle, you have one like on each side that kind of go behind the ears. There are different sutures. And so with mine was located in the front of my head. And so that meant that I have a scar from this side all the way across my head to the other side of my ear, where they peeled forward my scalp, peeled back my scalp, and then took out my eye sockets, to essentially break my skull and put it back together with rods and plates and fishnet wire, so that I would have room to grow, which is insane that medicine can do that. I had a neurosurgeon, I had a plastic surgeon, and then I had a craniomaxillary facial surgeon all working on me at 8 months of age. And it was a 10.5 hour surgery and resulted in over 400 stitches in my head.
First off, you couldn't even tell that you've had a surgery.
I know they did a fantastic job.
Absolutely remarkable job. I mean, and again, I get this all the time with me. It's like, oh, I'd never know. Like, I never know you have
That's
a
what
brain
I thought
injury.
when you walk. I was expecting a mangled person when Dr. Broom was talking about your accident, but
Yeah.
you don't look mangled.
Which is why it's so
I mean,
important.
crazy.
I feel like that's my mission now is just to educate. And your story, look, I don't pick favorites, but this one, holy cow, it just blows my mind. You, so, okay, 8 months old, you have this gruesome surgery.
Great, yeah, in every sense of the word gruesome.
When you, how long were you in the hospital after this
Yeah.
surgery?
So I was in the neuro ICU for about a week after, just to make sure that they had to monitor brain pressure. They had to monitor, make sure I was feeding. That was really hard for my mom because I wouldn't latch, so I no longer breastfed. I immediately just bottle fed, and that broke her heart. I mean, broke her heart. My dad said that's the one thing he'll always remember is she sat and cried by my crib because I wouldn't feed like an infant should or, like she wanted to. But they monitored and made sure that, my swelling started to go down. I've seen pictures of me. I look awful. I
Mm.
mean, I look terrible. My whole front of my head is just large and purple and so swollen. My scar is stunning. That's one thing my surgeons did a fantastic job on. There's a style of scar, it's called the zigzag, and it's beautiful. I mean, it's pure art. So I was there for about a week after, and then I was able to go home and live my daily life. I have pictures of me on the beach with my scar and my little shaved head, because they had shaved my hair.
Wow. So, okay, a week in the hospital. We got to see for our viewers some of those pictures so I can post it with this.
Yeah,
With
do I
these,
pull it up now?
you don't have to now,
Okay, I
but
didn't know
we'll
if I like showed the camera.
you can show it to me later, and we'll put it just on our
Yeah.
page. But aside from being in the hospital for a week, were your parents given any guidance on restrictions for recovery, or was there any physical therapy, cognitive therapy? I know you're only 8 months old, but what does that look like?
As far as I'm concerned, I had feeding therapy to make sure that I was able to, eat, swallow, hold a bottle. Because at around 8, 9 months, you can kind of start, you have those like motor skills starting to develop. Granted, my parents were new parents, and every time I ask them about this, they have blacked out this entire experience just because it was a dark time for
A
them.
traumatic
I
experience.
mean, it was extremely traumatic because not only is it an extremely gruesome thing to watch your child go through, but having it be your first child, I mean, it's crazy. It's absolutely insane. But I know, they were told keep the scar clean, make sure she's not getting infected, watch for fever, kind of all the normal things. I had follow-ups with pretty much all of my surgeons for, I think, probably every 3 months after for like up to a year. And then after, it was kind of just, make sure she's developing well. And I was hitting all my milestones. And so after a while, I just no longer had to go up to follow-up appointments,
Incredible. That
which is pretty awesome.
well, I'd say so. And then so this is so timeline wise.
Hmm.
8 months, at 8 months, you have this surgery.
Yes.
You recover every 3 months, you're going in for visits. Things look
Yes.
great. And
Hmm.
then we get to 12 years of age
Around 11, 12. Yes.
and things take a hard turn.
Take a steep downhill. I mean, a steep, steep downhill.
Was it from one day to the next that you noticed this, or was it slowly
I think
progressing?
it was kind of gradual. I look back, I was going through kind of my documents because I have so much documentation of all of my migraine diaries, all of my days in the hospital that I spent, my treatment. And I think it was kind of gradual. Probably started when I was, about to turn 11, 11-ish. And it just kind of started with, I was getting really bad headaches. They weren't quite migraines yet, but I was getting really bad headaches. And they didn't seem to have a pattern. I wasn't getting them, from drinking too much caffeine or not drinking enough water. I was a really active kid. I swam for, I started swimming when I was 5, and then I swam all the way through my senior year of high school. And so I was really active. I was drinking a ton of water. I was eating good. I had parents that made sure that I was, kind of doing all the right things to stay healthy. So I started getting those headaches, and then slowly they turned into severe migraines with aura. I couldn't see anything. They were impacting my schoolwork. I was getting called out of school, at least twice a week. I was having difficulty swimming. I couldn't swim anymore because every time I try and swim, I'd get this intense migraine and start kind of blacking out in the pool because my eyes were just auraing out. Um, and then I started kind of at around 13, 14, realizing I'd be in school. And then 30 minutes later, I didn't remember what the teacher was saying. I'd sit down and I'm listening to her, and then 30 minutes would go by, and I couldn't remember what she was saying. I couldn't remember if anyone had spoken to me. And I was like, what is going on? Do I have ADHD? Am I just not paying attention? Kind of, what's happening? And I brought all of this to my parents. My mom was like, here we go again.
Mhm.
And so that's kind of when we started seeking out neurology help because just all of these symptoms did not bode well with what had happened when I was 8 months old.
Right. So, and for our listeners, that those 30-minute windows, right? Where, wait, what happened? Why am I, did I miss
Yeah.
something? Those are absent seizures, correct?
Yes.
So
That's what we believe that they probably were.
I have absent seizures. That's one of my
Yes.
symptoms. So we overlap in that. And I also have migraines, the head pain. Um, those absent seizures are terrifying.
It was so terrifying, especially at, I was 13, 14 years old. And at this, at the age I am now, I have a lot of research and that kind of background in healthcare and knowledge of if that had just happened to me now, I'd kind of be knowledgeable enough to maybe know what it was or know what to do. At 13, I was like, what is going on? And I'm a straight A student. I love school. School is my favorite thing in the entire world. And so when I all of a sudden could not pay attention and I was missing large chunks of the day, I was like, what is happening?
Mm.
I was so confused.
You know, the best way I've tried to explain this to people that have never had absent seizures
Mhm.
is this is maybe it'll resonate with you because you're a swimmer. It's like you're underwater and then you come back up. It's like, whoa,
It's like,
like
whoa,
you're a part of life again. Everything's really
yes,
quiet underwater. You're not, your eyes are closed. You don't know what's going on. And
you
then,
can't hear anything.
yeah, yeah. I when I started having my seizures, I didn't catch them. And I was 26, so don't blame yourself for being young. But I attributed my seizures to, well, I was in LA when the
Hmm.
accident happened, living in LA. And then immediately after, for recovery, I moved to Austin to live with my mom because I just couldn't
Hmm.
function by myself. And I'd wake up and not know where I was, very disoriented.
Yeah.
And I was like, oh, it's just probably because I moved. And then it started happening in the middle of the day. And
Hmm.
then when I finally caught it and told my mom, I was like, look, I need to see my neurologist about this. I was driving.
I remember you saying, and that's terrifying.
Oh my God. But it's like you're almost on autopilot, right? Your teachers didn't notice. You're
Yes.
probably just looking ahead. For me, I thank God I stayed on the road or it was, those are so scary. And it's crazy that we overlap in
Yeah.
symptoms and then impulsivity.
That was a big thing. And it's funny because my mom always jokes that I have no filter and I've never had a filter. That is something that I think is really funny. But then when all of this started happening, and when I went to go see my neurologist, and we found out, I had this large lesion on my brain where it's consistent with blood loss or, oxygen loss.
Hmm.
And I did research of what this part of the brain kind of is related to. It is related to your decision making and your impulse control.
This is
And I was like,
right temporal or right frontal?
yes,
Right temporal.
yes, yes.
Okay, so
And it was just like, gosh, so I'm not just crazy because, when I'm in, professional settings or when I'm at work, I try really hard. I'm very, very aware. I speak very slowly because when I'm with people, when I'm with my family, when I'm with my friends, the impulse kind of just leaves the room. I
just let it
mean,
rip.
it just goes. And it's gotten me in some trouble with my parents. Sometimes I say things to my friends. I'm like, why did I say that?
Okay, you're teasing us too much. Please give us some examples. We need
I
context for
mean,
this.
I'm trying to think. I mean, a lot of the times it's just really inappropriate jokes.
Now, is
I
it
mean, just,
okay? That's awesome. I love that. I think I told inappropriate jokes before my accident. I still tell them now, and so I
or
can't blame it on the
even
brain injury. But is it more like,
like,
your friend's wearing a shirt that you think's ugly, and then just like out of nowhere it pops off?
yes, yeah. And it gets me in trouble with my mom because my mom is my best friend. I love her so much. But sometimes I just say things that are kind of mean. They're just kind of mean. And I say it and I'm like, oh crap.
Yeah.
I shouldn't have said that. And she'll look at me, she's like, Sophia, why did you say that? And or I'll say it in like a setting of a million people. And it's embarrassing to her. And I shouldn't say things, that call her out or, call something out about what she's wearing. But sometimes it just lets out and I can't help it.
Now, do you
You
ever
know,
direct those comments or those thoughts, I guess, aloud to strangers, or is it only to people you know?
I try really hard. I don't talk to strangers. I don't really like strangers that
Yeah.
much.
Fair, fair. Then your parents taught you well, right? Stranger danger.
Yeah, I don't like strangers.
I'll tell you this. So, just since you told me, I'll share with you my impulsivity. I have to take a medication for it because it's like
Mhm.
bad, bad. Um, and I've never acted on it, but it would be like driving on the freeway, and my brain's like, put the car in park.
Oh, I want to swerve off the road.
Yes, yes. And
Yeah.
then like another one is oh darn it, what was it? It's oh kind of messed up. Standing in line at a grocery store, which I hate. I hate grocery stores. It kills my head. And it's like, I should just punch this guy in the back of the head. What?
Yeah.
That's not you,
Like it's
Evan.
insane. It's
Yes.
crazy. And sometimes I try and explain this to people. Sometimes it's that kind of thing too. Like I'll look at someone like, gosh, I really just want to like slap you. Like I'm not gonna, and I'll think about it. I'm like, why? Oh my gosh. And when people think about impulsivity, they're like, oh, haha, it's so funny. Like impulse control. I'm like, no, like I genuinely have impulsive thoughts that are telling me to do harmful things to others or harmful things to myself. And it's like, whoa, what are these thoughts?
Sophia, I love you. Like, it's so nice to
Like,
talk to somebody that can relate. Those same things, hurting myself, hurting others, where you become scared of
it's
yourself, where
like,
it's
oh
like,
my gosh, it's terrifying.
why am I
And then when you
thinking
start
this?
experiencing that at 12 years old, like that's really scary.
Oh my God. Yeah. Yes. I mean, 28, 29, that's when they really started to ramp up. It's like, this is like, am I losing my mind? I never
Yeah,
thought like this. I couldn't imagine being in middle school with those thoughts.
exactly.
Good Lord, look at this. You
Exactly.
were tiptoeing around it. You're like, oh, it's just saying a shirt's ugly. No,
No, it's
that
all
like,
like, and I still like, I'll be driving. It's like, okay, swerve off the road or run into this car next to you.
yes,
What? That is not a normal thing to think
it's
about.
not. And I
That
get,
is not.
oh my God. Since I've had to up the medication quite a bit. Are you on anything to help with the impulsivity?
No,
Okay.
because that's one thing. have been in therapy my whole life to
Yeah,
kind of work through impulse control, work through, trying to like help not have to go through medication because I am on medication for a slew of other things.
I
And so
feel
kind
you.
of adding on more medication at such a young age was not something that I really wanted to do.
Totally, totally understandable. I feel like I can finally breathe, which I know
Mhm.
people hear that they're like, "Oh, you're dramatic," but it truly, I with the
Yeah.
medication that I'm on, those impulsive thoughts have almost disappeared. I still get them. They
Mhm.
creep in, but I was truly scared of myself. I was telling my neurologist, I was like,
It's terrifying.
yeah, it's like I battled to like these thoughts come up. It's like, dude, that that's not you.
Yeah.
Like, why are you having these thoughts 3 to 4 times a day?
Yeah.
It's oh my God. But since I've done the medication, maybe one or two like pop up a week, which I was like, well, that's normal. Everybody has, impulsive thoughts
Like,
sometimes. But like, golly, Sophia, I feel for you, girl. And good on you
it's
for going
rough.
to therapy. Like I've been to therapy a bunch, and I don't think I was accepting of my impulsive thoughts for a
Mhm.
while until it got really, really scary.
Yeah.
Um, but like where I'm almost like fighting my hand not to put the car in park on the
That's
freeway.
terrifying.
Yeah, yeah. I mean, maybe like it's just that may be like maybe a little over exaggeration, but it's just like you get chills in your body. You're like,
Yeah.
what is going on? Oh, good Lord.
No, I
Okay.
agree.
I mean, thank good. Hey, we're, sisters, girl. We got this.
Yeah.
We're in it together.
I
Okay,
haven't
so
ran over someone yet, so we're
yo,
good.
dude, for real.
I haven't done it yet, so
Yeah,
hopefully I
yeah.
won't do it
You won't.
soon.
You won't. We'll hold each other accountable.
Yeah.
Okay, so this this transgression or this progression of pain, impulse control, um, and then absent seizures,
Yeah.
they're trickling in, and then you go to get an MRI.
Yes. So we go to Children's in Dallas, which I've been followed by many different specialists. I've slew of health problems, not just the neuro problems.
Mhm.
My parents really got it rough with me. But we go to Children's in Dallas to the neurologist, and at first she really, because at like 12, 13 is when most children start going through hormonal changes. She's like, maybe it's, setting in of like puberty, because that's for a lot of girls, that is when migraines start to set in, is when they're starting to go through puberty. So she was like, maybe we're gonna try and, let's try and back off a little bit, keep a migraine diary, let's track these absent episodes, see if there's like any pattern with maybe, time of the month, whatever. That didn't work. And so we go back to the neurologist, and my parents are like, let's just get imaging at this point because, we were kind of at a loss. We tried I did like three different sleep studies. I did an EEG. And the thing with, absent episodes and absent seizures, you can't really predict when they're going to happen. I have a friend actually in college that has seizures worse than I ever, presumably had. And she went in for, an EEG. They didn't catch a single seizure, not a single one. And this girl has, 15 to 20 a day. And so we go in for these episodes or these studies, and they're not catching anything. And so my parents are getting frustrated at this point. I'm getting frustrated because I'm feeling like nothing's done. So we go in for the MRI. I believe that's what I had. Have the MRI done, go in for, the evaluation. She's going to tell us what she saw. She pulls up her chair, she crosses her legs and then turns the screen away and just starts interviewing my parents, to see what could have possibly happened. And my parents are getting scared because they're like, what does she have? Like, is it a tumor this time? Wasn't a tumor the first time. Is it a tumor this time? Wasn't a tumor, but she was like, she has scar tissue that, you know, we don't know what it is. It's like, that's insane.
Yeah. Now, did they attribute the scar? Did they ever figure out was it from the compression of the brain into the skull as a kid?
Yeah, so then she kind of, started asking my parents about my surgery, and they were able to kind of put two and two together that when my eye sockets were taken out, and they're working with that front part of my head. Something probably got nicked,
Uh,
something probably happened. And she did, my parents did kind of explore the option of opening up like medical malpractice lawsuit or like trying to investigate, what happened. Or there records anywhere that show maybe something happened? But we kind of had a long talk as a family because all of my surgeons are really good friends of ours, like
mm,
have become family. One of my surgeons has watched me grow up. He's kind of followed my story throughout, my entire lifetime. He's watched me beat odds that like most kids dealt the cards that I've been dealt don't beat. He still keeps up with me, he knows that I'm in college now. He knows that I want to pursue medicine. And so I kind of made the decision for my family that I didn't want to open up that can of worms in case there was any kind of malpractice or any sort of, foul play that
hmm
happened during that surgery, just because it didn't seem worth it to me at that point.
hmm
We know I have the scar tissue. We know that, part of my brain is missing. It's what I say, it's my favorite thing to say is my brain's missing. um we know it's gone, and I don't really have closure of like what happened and why it's gone, but I didn't want to bring about that stress for my family or even the surgeons that have besides that helped me and allowed me to grow up.
Right, right. Yeah, what a tough decision to make. I see both
Yeah,
sides of the coin. And that just shows truly how selfless you are,
yeah,
right? Being appreciative of the work that they did. And granted, if something did happens, I wish they would have had transparency, but it's pretty astounding where you are
yeah. And like
with,
the hard thing too is like we kind of put two and two together and we think that's when it happened, but who knows, maybe, because even another possibility is she said the lesion is kind of consistent of what stroke patients go through when part of their brain dies off. So she was like, maybe you had a stroke as a kid and you just
wow.
never knew. And I was
Yeah.
like, well, that seems even more unlikely, but there are just so many different possibilities that trying to find and pinpoint the exact cause, if it wasn't my surgery, it could have been so many different things. And
hmm
so to me, it just wasn't worth it going down the rabbit hole of starting with the surgery, which at this point was, it's been 12 years. 12, 13 years. And I love my parents. They have no clue where my medical records are. And so we'd have to find all that and go through, we're in Texas at this point, talk to my surgeons in California. So it just wasn't worth it to me at this point.
Yeah, that'd be even more of a headache. Good
Oh,
Lord.
yeah.
Now, I just want to revisit one thing because our viewers might not, or our listeners, viewers might not know this. EEGs, you had talked about it. I've had so many. It's
Oh,
where
yeah.
you put a bunch of electrodes on your head
Mhm.
and they're trying to capture the moment your brain misfires.
Start seizing. Yeah.
Yeah, where you have seizures. And you had talked about it where it's really tough to catch it. I went into the neurologist's office. They put it on my head and it's almost like you're begging your brain to have one
It's like,
because
just have one, please.
and they're putting strobe lights in front of your eyes. They're telling you to do all these
Yeah.
weird breathing techniques.
I had school the day I had mine, and I wasn't allowed to sleep the night before.
Yes, like it's
Yeah.
crazy. And then it's like a 30-40 minute test. I forget how long.
Yeah.
And then, the tech can't tell you if they saw anything, even though I try to muscle it out of them. Then you get a call from your neurologist a couple days later, like, hey, we didn't see anything.
It's like, okay.
Then you advocate, and I'm sure you do this. You're like, well, something's definitely wrong. Okay, let's try a 24-hour one. And then you do that. That doesn't show anything. Okay,
Yeah.
let's try a 72-hour one. It's good
It's
God.
really frustrating.
Oh my Lord. Finally, they caught one on my 72-hour exam, which I'm so
Hmm.
thankful for. But it was such an uncomfortable experience because your head's wrapped with these
Oh, yeah.
wires. Did
God
they?
bless my mom. She posted this on Instagram. I was so mad at her. I was angry.
Wait, she posted that picture of it?
Oh yeah. Oh yeah. With the stupid bandages, with the electrodes coming out like a ponytail.
Yes, and you
I
have like a
mean,
fanny pack with the
with the
battery.
fanny pack, you're covered in gel
Ugh.
and stickiness. And I'm very tactile. I don't like certain textures and certain, feeling. And I was so uncomfortable.
Oh,
And
I
it's
feel that.
awful.
Yeah, and my head's very sensitive since my accident.
Hmm.
And any restriction on my head, like I keep my hats very loose, it
Hmm.
just makes the pain so much worse for me. And then,
Oh
well,
yeah.
since you have like this electrical device on you, I can't use my ice packs. So those 3 days, I was struggling.
Just like let
Oh
it
my
end.
Lord. Yeah. So did they end up capturing one during one of those
Nope.
tests?
Not
Never.
a single, because I did a 45-minute one, which was the sleep deprived. I couldn't go to sleep the night before. I went to school for, half a day, and then I went and they did the strobe lights, they did the weird sounds. They also told me try and take a 15-minute nap. I couldn't
Yes.
go to sleep
At the end of
because
the
you have,
test.
and I'm like, I have stuff all over my head. I can't go to sleep. And so they didn't catch anything there, and then they do a 24-hour one.
Mhm.
This was awful because I was at a point in treatment too where we were exhausting all methods for my migraines. I was kind of at my wit's end. So the day before my 24-hour like sleep study and EEG, I got nerve blocks in the back of my head and neck,
Been there.
which was the worst experience of my entire life. It was so painful. Um, and so I was completely numb, the back of my head, and just very uncomfortable. That was 24-hour study, didn't catch a single thing. And so at this point, they were kind of like, she probably doesn't have absent seizures. But I was like, I'm not paying attention in school because I am missing 30 minutes at a time, 20, 30 minutes of with class. Something's going on.
Mhm.
But at this point, we're just kind of like, okay, sure, whatever.
Golly. So when are you on any anti-seizure medication?
One of my medications doubles as an anti-seizure medication.
Perfect. And then
It's for, depression, but it also doubles as anti-seizure. So it's kind of like a double whammy. We never really got an answer for that, but I am on it for both depression and also anti-seizures.
good, good. One of mine, I'm on two anti-seizure, one depression, ew, and then one anxiety med,
Yeah.
which has helped with the impulsive thoughts, the anxiety
Yeah.
medication. So when they put you on that medication that doubled, have you
Hmm.
stopped having these moments?
I still occasionally do. I it's honestly kind of hard to see that like when I started the medication, because when did I start that? I started that medication, I was 14, 15. I was like 14 or 15 when I started it. I think for a little while after, I kind of was still having those absent episodes. And I vividly remember having one in the pool swimming, like so incredibly vividly. I couldn't swim my sophomore year of high school, which it was awful. It was really heartbreaking for me. Couldn't swim because I vividly remember I'm swimming in the pool, and then all of a sudden someone kicks me in the head, and I like had been absent for like maybe 5 minutes and was just kind of like floating-ish. Um, and so then after that, they kind of just like trickled out, and I don't really have them anymore, which is good,
Good, good. Oh my Lord. Oh, you've been
which
through it.
is crazy. Oh
Wow.
yeah.
So we're here today, right?
Yes.
We've been through all these medical challenges.
Mhm.
Has life, what does life look like now after all this, right? I want two perspectives.
Okay.
How have your parents approached this? Your medical history, right?
Hmm.
And then how do you view it? And then we'll get
Hmm.
into life now. But I think that would be an interesting perspective for our listeners to hear. Are your parents, and I say this with, a term of endearment, are they helicopter parents? Like, we got to make sure she's okay at all times. Like, do they frequently check in on you?
Yes,
Same. My
they
mom's the
sure
same way.
are.
Yeah. And I love
Which,
it, but it's
granted, I think part of this, half of it is probably my medical history, and then half of it is I'm their first child. I'm off at college. I'm as my dad, like I'm my dad's little girl,
Aw.
So I think part of it is, my medical, and then part of it's also like I'm their first kid. I think
Mhm.
any parent would be helicopter over their first child moving, 3 hours away. But I do notice like my parents are very proactive when it comes to anything I say regarding my health, anything, if I feel like I'm off, if I don't feel like something's right. I know some people have parents that are like, you're fine, stick a band-aid on it, you're good.
Mhm.
And to an extent, I do think, kids do need to grow up and be independent and kind of know how to handle their own issues. But then also, parents need to be the guiding light in navigating, okay, you've been off for a week, maybe we should go see someone about this, or, and I'm really thankful because I think of what I went through. The second I feel like something's not right now, my parents are very much, let's make an appointment with your doctor. Let's, maybe change your meds. Let's get you an appointment with your therapist. Like, let's try and do something about it instead of, you got it, figure it out. And they are helicoptered. They do check in on me. They make sure that I'm okay. My parents are here almost every weekend,
Amazing.
because they love college life. My parents love being in college. But I do think a lot of it has to do with, they went through hell with me as a kid. And so they just want to make sure that I'm okay.
Fair, fair. They have,
They have every right.
yeah, exactly. And I love to hear that they're proactive when you do mention
Yeah.
something. Can they, my mom, it's like mother's intuition, right? My mom, my
Hmm.
brother. So I live with my brother, sister-in-law, and
Yes.
girlfriend, and they really help with day-to-day stuff. My family's very observant
Hmm.
of obviously I've changed since the accident. Pain wise, it's consistent, but when it really spikes, they're quick to notice it and they're quick to
Yes.
pull the reins back. Are your parents very observant on, whoa, Sophia's been off these last couple of days?
Mhm.
Do they check in with you on that? Do you notice that where it's like, oh, damn, okay, they read that correctly. Yeah, I have been off.
Sometimes I don't like to admit it because I'm really stubborn and I like to be right. No one is more correct about my health than my parents are. Typically, my mom knows when I'm about to have a migraine or I have a condition called cyclic vomiting syndrome, which essentially causes you to throw up and go into a coma-like state, because your body just keeps vomiting. Um, yeah,
Oh
just we're
my
gonna keep
God.
adding on.
Is
But when
this,
I'm about,
sorry, is this a effect of the neurological?
nope, not
Okay.
at all, completely separate.
Wow.
Yeah. And so when I'm about to have a migraine or a CVS episode, my eyes get really red, like, and my under eyes get really red. Like I look flushed almost. And I'll FaceTime my mom and she looks at me and she's like, "Do you feel okay? You good? Like, how do you feel today?" I'm like, "I'm good. Why?" She's like, "Your eyes are red." And I was like, "Okay, well, you need to go lay in bed for the next, day." She's so incredibly observant, or even we talk every day. And if I don't talk to her for a prolonged period of time, she knows something's wrong,
Wow. Oh, that's
which is
fantastic.
she's so observant. I mean, she knows me better than anyone. So does my dad. We'll be talking and he'll look at me. I'm really telling with my eyes and like my top half of my face. He's like, "Your eyes don't look good. Like you need to go to bed."
Wow.
Like, okay, great.
Yeah, yeah. Early bedtime tonight.
Okay, okay.
So I no longer live with my mom, but she can hear it in my voice too,
Hmm.
which is amazing. I mean, mothers are fantastic. We're
Yeah,
both very fortunate to have an incredible supportive system because sadly, with some of the people I've spoken with, they don't,
yeah,
which is sad. And another reason why I've started Toro and Tides is to build that community because somebody listening to your story is going to be able to relate, right? And
yeah.
then they might reach out to you through the social media. Oh my God, why did I say it like that? Through the social media. That's aging myself through social media. Don't try to
Yeah,
save me, Sophia. Don't try to
I'm
save
not.
me. But it's we're very fortunate
Yeah.
with okay, so life now. You've
Hmm.
had hell as a child.
Oh, yeah.
What
There's
is
no
life?
other way to put it.
Yeah, what does life look like for you now? How do you navigate these conditions? How do you have a positive outlook on, hey, I'm going to med school. I want to, so many kids could have just like rolled over, and,
Yeah. Oh,
uh,
I definitely did. The first 3 years of my high school career were awful. I mean, it was awful. And then on top of it was COVID. And so like very isolated.
mhm,
But then finally I kind of started seeing the light like my senior year of high school, my medicines were really working, great support system, great therapist. I was like starting to kind of see like, okay, I can go a day without having a migraine. I can start kind of paying attention in class. My impulsivity is getting under control. Maybe things are going to be okay. And now, like I can say now, like life now is 10 times better than freshman year of high school me would have ever imagined. I think when I was starting to go through all of this, I was like, gosh, could it get any worse? Like, good Lord, I'm about to dig a grave and go sit in it. Like,
mhm.
can't do this anymore. But slowly starting to get, my support system in place, now, I mean, it's crazy what modern medicine and what, having good parents and good friends that also understand me and they know my cues, they know when I don't feel good. My roommates are so supportive in that way.
Good.
And they're the reason I've been able to now get through 3 years of college, next year four, and then move on to like something I've been working towards my entire life.
Amazing. That well said. And that's motivational, inspirational. I
Yeah.
mean, you you embody it all, right?
Thank you.
Your I mean, your commitment to making this bad deal of cards turn into something better. I mean, you got dealt a horrible stack. Um,
Pretty horrible, but something that like also keeps me going is I work in a children's hospital, in an ER, and I see worse, and so some days where I'm like, gosh darn, could it get worse? Yeah, it
yep,
could get worse, and some of these kids that I work with, they don't have the support system or they don't have doctors that believe them, which I've had doctors not believe me
same,
before.
same.
And so seeing these children, they're the children that I want to help one day. So it's also what helps me,
Turning something
keep
bad
going
into
and
something
keep
good.
pushing.
Yep.
Yeah.
Wow. Okay. I know we've been going, your story is so fascinating, and I know we need to wrap this up, but I just have two more questions.
Okay.
One is about transparency. And
Okay.
since you're young, I think our younger listeners could benefit from hearing this. You talked
Mhm.
about your supportive roommates.
Yeah.
Um, how do you approach those conversations? Because did you meet them in college, your roommates?
This is a great story. So one of my roommates, she did the whole Instagram DM thing
Yeah.
where, hey girl, we're both going to the same college. She's gonna hear me through the wall and she's gonna get so mad at me. But she Instagram DM'd me and we kind of made a roommate group. There's four of us in my roommate group right now, but there's a group of six of us that are really close. And we've all kind of traded roommates throughout the years. Um, but I remember my freshman year, I was really upfront. I was very upfront with, these are the conditions I have. Sometimes I have really bad days and I'm not going to want to leave my room, or I'm going to need you guys to be quiet, or, I'm going to need maybe someone sitting with me and making sure I'm okay. Other days I'm going to have great days and I'm going to want to go out to dinner with you guys and want to, hang out. But I'm just asking for, patience and support throughout, and I didn't expect, we bonded so well that we've been roommates for 3 years now, going on four.
Fantastic.
Um, but I think the important thing is transparency, going into it, because there's nothing, in my opinion, scarier than meeting someone new, but then being put in the position where they're having an absent seizure, or, with my cyclic vomiting syndrome, if I'm vomiting everywhere and all of a sudden you're like, yo, what the heck,
Hmm.
being put in that position, honesty is key. Now, don't do it if you're not uncomfortable. You want to be comfortable with the people that you're disclosing, really vulnerable information to. But building that support system, the first step is being honest with those people you want that support from.
It's very important. So, so
Yeah.
important. And I've struggled with that in the past when I wasn't
Mhm.
accepting my injury. And I
Yeah.
tried to bluff my way through situations or push through it when my body was screaming at me to stop.
Oh,
So I
yeah.
think a valuable lesson for people listening, what they can learn from you is honesty is the best policy. I know that saying is
Yeah.
beaten to death, but it really is because you will find people that are supportive and understanding.
And a lot more people are supportive than I think, because a lot of, hiding it comes from, oh, what are people going to think of me? Are they going to think I'm weird? Are they not going to want to room with me? You know, but I think a lot more people are understanding these kinds of things than a lot of people realize. And I've found, like, in college, everyone I've ever told about my whole entire health history has been like, whoa, I'm sorry that happened to you. How can I help? That kind of thing.
Amazing. Okay, one more question for you.
Hmm. Yeah.
You have a very unique experience, and I don't know how many kids are affected by this every year or
Mhm.
you know, I think the big thing I'd like for you to share is you don't remember a lot of your childhood, right? Because it
Mhm.
was 2
Yeah.
months, 3 months. What would your message be for parents that are in the thick of it right now, where there's that unknown or they just recently been diagnosed with this? So that's part A. And then part B is
Mhm.
you offering guidance or support for somebody your age that has lived through this. So if you could break that down for me for this audience, I think it'd be very beneficial for them.
Yes. Let me think. So, for parents, there is light on the other side. I'm sure when my parents went through it, they did not think that. They did not think that about when they were going through, when I was an infant. They didn't think that when I was 13, 14 years old, needing to be called out of school. They're like, this is a very dark time. This child is going through hell. Like, this is awful. But now, I mean, my parents still say this. There is light on the other side. There will be a time where you can watch your child grow up and you'll look back and say, dang, we got through those hard times. We got through it and we got through it together. And then for kids or, young adults, teens also going through, similar injuries or trying to navigate, doctors not believing you, going through, confusion of health, health issues, your body best. Listen to yourself. And it goes the same for parents, but especially for kids, you know, more and more doctors are starting to trust young adults and teens with, their own health care. I see it in the hospital every day. Like you live in your body every day. Trust yourself, trust your gut, and that is how you make a difference and make a change to where you can live a better life that you're trying to get towards.
Very well said.
Thank you.
Sophia, in closing, I just want to tell you I am so, so proud of you. If your
Thank you.
if your parents listen to this, I want to tell them or y'all, thank you. Thank you so much for supporting your daughter and for seeking out the right treatments and not giving up because you have raised a remarkable daughter. She is
Aw,
fantastic and she is doing so well. And I just am so thankful she came up to me and wanted to share this story and had the courage to share it on social media when a lot of people wouldn't. So Mr. and Mrs. Sophia's dad. Thank you so much. Sophia, thank you. Keep going. I can't wait to see how you change the medical field because you've lived it. You'll have a better understanding. You're going to have a fantastic bedside manner. I know we just met a couple times, but I love you. I'm so proud of you. And thank you, thank
thank
you, thank
you.
you for coming on to Brain to Brain.
Thank you for having me.